Diabetes is a really significant problem. The CDC estimates that for Los Angeles County in general, about 8% of the adult population is diabetic.
Here in Southern California, particularly this region that we serve around Pomona Valley Hospital, the percentages are much higher, much higher. Inpatients that we see on any given day, 25% of them do have diabetes. There is another 35% that have pre-diabetes, so 25 plus 35, it's 60% of folks that are in diabetes risk range or they have diabetes. That's a lot of people that we want to help. We have a wonderful inpatient program, so we do really well taking care of the patient here in the hospital, but when they leave, there's not a lot out there for them, and so that's where stopping diabetes in its tracks comes in.
We've started to put a collaborative together of different community partners to say, how can we stop diabetes in its tracks right here in Pomona?
We received a grant from UniHealth to fund a project in which we help people to conquer this disease in the way that they have the power to take control of it.
This is a program that's very unique because it is so collaborative. Diabetes is a very big problem, and it takes more than one field or one profession to really address.
We are divided in 3 groups within this effort. One of them is the hospital what we call the inpatient setting. We're going to try to capture patients there. The other setting is the community. It will involve schools, churches.
The key is, if we go to where the community is, then we reduce a lot of the barriers of coming to an actual traditional setting where the doctor gives you your results or you have to go get your blood drawn at the lab. But if we're there, we're where they are, then we reduce a lot of those barriers and we can actually meet them there and have them know about their health and know that they may or may not be at risk for other issues.
The other setting is the community clinic. We have 2 clinics that are associated to our program. One is the Family Practice Residency Clinic, and one is the Park Tree Clinic.
For us in our community, obesity, poverty, late access into care, all of these things impact diabetes and the outcomes. And what's good about this project is the emphasis on testing people for pre-diabetes, so before they become sick. So if you can intervene, if you can interact, if you can stop someone from developing diabetes through weight reduction, exercise, and just healthy habits in general, education, and knowledge about what they're doing, then you can prevent the diabetes, and that's really what we want to do as a community.
Upon discovering if they have risk or they are diabetes out of control, we are going to offer an intervention, and we're doing that for free. We will improve the health of this community with the interventions.
The planning grant proved itself that we could go higher with this. We could do more with this.
And now we're in the second phase of a grant. Just at the start of our project, that'll go into 2021.
This is a 3-year grant, and the whole goal of this is to sustain in the community.
Its purpose is to create a program that will help bring in these tools, educations to the patients that have diabetes or are on the brink to have diabetes.
The collaborative nature of this project, how many institutions are involved, and coming together to try and meet those outcomes, to me, is the most exciting part about this project.
This is the merging of academia, research, community-based organizations, and future leaders. So the potential for this to impact multiple generations of both healthcare professionals, of researchers, and of our patients and of our community, that's what makes this such a phenomenal, collaborative, and an important project.
We're trying to create what Robert Wood Johnson Foundation would call a culture of health in the community that pervades all of the relevant institutions and agencies that could play a role. You don't do it in a clinic alone. You don't do it in a hospital alone. You don't do it in a school smoking prevention program alone. You got to do them together.
I guess there's a geometry expression, the whole is greater than the sum of its parts. And that's really what I can say about this collaborative, that together we give our community a better chance for a better outcome.
Diabetes is an epidemic in the country. And it does take a community to do something about it. It's not just us working, doing one thing, and then having a Park Tree Community Health Center doing their thing and somebody else. It's much more exciting to bring collaborative partners together, because the sum of all these parts coming together is going to make a tremendous impact on the city of Pomona and any community that takes up an initiative like this. We're already seeing it. We are already seeing it.